In every part of the globe, the poor and vulnerable among us struggle in everyday life. Unfortunately, for many, minor health issues can become a death sentence when basic health care is not available. For Dr. Vincent Ohaju, similar events he witnesses as a child growing up in Nigeria are his inspiration to step up and to make a difference.
One of members of the youth group in my church died from complications of appendicitis without the benefit of surgery. Even though the diagnosis was accurately rendered, there was no money to get the surgery for her, so she died. And another one was a man who had 4 children, who was in his 40s, who died from complications of spinal cord injury without the benefit of a trauma center or surgery because it wasn't available. And of course, the one that was very immediate to me was the loss of my father in 1983. A 56-year-old man who was father of 6 children with no previous medical history, who died from complications of pulmonary aspiration because there was no opportunity to provide him with bronchoscopy in a 5-minute procedure that would have kept him alive. And these incidents actually became the driving force in my life to pursue a career in medicine and ultimately surgery.
Through the generous support of a nurse and family friend, Vincent receives a tremendous gift, a medical education in the United States.
I feel like the woman gave literally her all. That was her retirement money that she spent to pay for my tuition to come here. So why wouldn't I? Yeah, there's no reason why I wouldn't go back.
Dr. Ohaju is a trauma center medical director and surgeon. With his medical career progressing, he explores options for helping those in need back in Nigeria. And in 2004, in honor of his father, the VOOM Foundation is founded as an international medical humanitarian organization.
The Nigerian healthcare system currently is antiquated. I will say that it's substandard. It is a measure of status in the sense that very wealthy people understand that there is no adequate care in Nigeria. They can pursue health care overseas because they can afford it. And that leaves a great majority of the country, and that's better than 90% of the population at the mercy of a substandard hospital system.
Poor and vulnerable patients in Nigeria suffer low treatment success rates and negative outcomes due to geographic and financial barriers beyond their control. These patients often delay their decision to seek care due to the distance to healthcare facilities, resulting in a high mortality rate. This is particularly the case in rural areas where there are few facilities and transportation systems and roads are poor. In the city of Enugu is one of the top teaching hospitals in Nigeria, the University of Nigeria Teaching Hospital. In 1974, UNTH is considered a cardiothoracic center of excellence and pioneers the only open-heart program in the country. By the year 2000, they complete a total of 102 open-heart cases in a country with a population of 126 million. Unfortunately, in 2003, UNTH abandoned its open heart program due to financial burdens. Through conversations with the UNTH leadership, VOOM agrees to an international partnership with the goal of rebranding the hospital and expanding service areas to include a cardiac intervention program. Dr. Ohaju and VOOM now have a facility to go to work.
Obviously, the problem is enormous. It is not a problem that can be easily solved by one individual or one group. And to revamp the entire healthcare system is almost impossible for any one group to do. But we have to start somewhere. And that somewhere for me was starting with open heart surgery program because prior to 2013, there was no active open heart surgery program in the country. Even though there is high incidence of cardiovascular disease, a lot of these patients were going to India or United Kingdom or United States, Germany to get surgery. And so the poor people who couldn't afford it, just simply died. And we decided to make a change. And that's one area that I know that we can do something.
Through VOOM Foundation's partnerships with private businesses and nonprofits, surgeries resume in March 2013 with a 2-week-long mission trip of 20 U.S.-based VOOM volunteer medical team members.
A typical mission usually has 2 surgeons, an intensivist, a cardiologist, 2 perfusionists, a respiratory therapist, usually 4 to 5 ICU nurses, and in some of the missions we've had a chaplain go with us, and obviously an administrator.
Each VOOM medical mission typically includes a group of up to 20 medical volunteers from across the nation. Each medical volunteer is recruited with the intention to provide training and teach best practices to the local medical staff at UNTH.
I'm a cardiothoracic surgeon. Right now I'm practicing in California, but my life history goes way back when I actually was born and raised in Tehran, Iran. January of 2013, I met Dr. Vincent Ohaju, and he shared his vision about the VOOM Foundation and what they do in Nigeria, and that was exactly what I would love to do for years. I did my first medical mission in Nigeria in December of 2013. Since then, I've been to Nigeria twice, and I'm planning to go the 3rd time in a few months.
The duration of each trip is approximately 2 weeks, which includes evaluation of patients and confirmation of diagnoses, followed by patient selection, dictated by available resources. The team's goal is to perform 2 to 3 cases per day, contingent upon ICU space. Due to lack of ICU beds, the medical staff has to occasionally wait for beds to open prior to starting a new case. Since 2013, the VOOM Foundation coordinates a total of 11 medical missions and assists in 5 others. To date, VOOM medical teams have performed or supported a total of 152 open heart procedures, far exceeding the 102 cases in the previous 26 years.
We need partnership, in trying to be able to establish what the ultimate goal is for us, which is being able to get brick and mortar. We get to a point where the VOOM Foundation has been able to establish a hospital in Nigeria. That's going to do a big deal for the country, because that will be the first time, frankly, that we can actually draw on the Nigerian personnel specialty to go back home and be able to deliver care in a place that they will be able to see people that look like them, maybe their families or their friends. We hope that once that's done, it will be a ripple to be able to replicate that all over the country.
VOOM's most recent and significant development is the possible donation of an existing hospital located near Enugu. This property is almost perfect for VOOM's needs. It's a modern facility and it's near completion. It has the potential to accommodate 200 beds, multiple operating rooms, and ICUs. The big obstacle is raising the funds needed to complete the facility and to operate it.
So what we're doing right now is working with people who are capable of making the diagnosis, who are also capable of managing the patients medically even after you have done the surgery. So we take a team here, we bring heart valves, we go over there, we replace the valves. Once the patient is operated on, all the follow-up is done with the local staff. Imagine what it would be like, though, if the surgery itself can also be performed by the local staff.
To date, VOOM has many notable successes. The smiles on the faces of patients and families tell the real story. Restoring lives, training local medical staff and support services, and more important, the opportunity for a future with hope.
And it's beyond words. There are some families that we have operated on that make it like a mission. Every single time we come for a mission, they know that when the team is coming, and they come back to say thank you.
VOOM has many needs with numerous ways to support. The invaluable time of our volunteers, our traveling medical teams from surgeons to support staff, and stateside support of planners and coordinators, our industry and professional partners who contribute medical supplies and equipment, medicine, technologies, and expertise, and of course, our financial supporters who cover everything else, ultimately impacting the lives of grateful Nigerians. And we are just getting started.
I don't think words can explain that. The feeling you get when you provide the service to people who have no other choice. They're gonna die from heart disease, and I am the only option they have. It's just such a joy and satisfaction when you see them get better and feel better. You give them life. I mean, it's a feeling that I can't even explain how wonderful and how rewarding and how satisfying that is.
The fact that they are given an opportunity to get life is something that we take for granted in this country. So families are very grateful, and it shows. And that's the reason why people who have gone on the medical mission want to go back, because these families impact them. Is to do the things that you do every day here. Yeah, families thank you and so on and so forth, but it's a different level when people feel like they owe their life literally to you. Yeah, it's a bit humbling.